Yeah, I mean, I found really concerning stories from prisoners and from former staff alike. One thing that I was rereading the article before this, and I was reminded of one of the former, well, actually, I think still current, and he's named in the story, Jason Sylvia. He was totally open to being on the record, and he spoke to me about the transition that happened between the two companies. And so the issues that they had with filling staff and basically some broken promises about how new staff would get raises under the new contractor. And then the new contractor came in and said, that's not our problem. We didn't promise that. And I think what Jason kind of highlighted really well was the sort of the disorganization that can happen. And, in the private industry, like if you're just talking about, I don't know, a private industry that sells shoes or whatever, and you jump from one company to the next and there's chaos, okay, that's fine. They don't sell as many shoes. But like when you're talking about people's health and you have chaos that's happening in the transition from one company to the next, you have staffers that are being overworked, people who are looking at like upwards of 100 hours a week as nurses and healthcare staff. So that's sort of a recipe for disaster. And that was within like the first month or two of the switchover. And then you also have on the patient side still issues of people like not getting specialty care, not getting follow-up for care, and their doctors even writing down, in official documents, like, I'm concerned about my patient